Hi everyone, this is Dr. James Lin. I'd like to welcome you for this particular series of presentation on shoulder pain. This DVD is we're gonna be talking about severe chronic shoulder pain and how we are going to handle, what kind of test is going to be available, what kind of treatment protocol is available. Again, this is an informational DVD only. We're here to give you information so you will be educated. So whenever you have a severe chronic shoulder pain, you're gonna know what to do. And when you go to a certain doctor, if they show you X-ray, MRI, you are going to know exactly what's going on. Again, we are here to give you information only. A lot of patients, when they come to me, they have already gone to many doctors. They have gone to orthopedic surgeons, they've gone to their medical doctors, they have taken painkillers, they have gone to physical therapy, they have gone through exercises, stretches, they have gone through acupuncture, chiropractic adjustment, they have gone to massage therapists, and their pain just will not go away. And the shoulder pain gets worse and worse. Or the shoulder pain gets better for 1 day or 2 days, but the pain come back again. Keep on coming back. Or the pain, they move around. Sometimes the pain is here, sometimes the pain is here, sometimes the pain goes down, sometimes it's up. There are running pain. And they get confused and they don't know what's going on. So this is for you. This DVD is for you. It will explain, it will unlock all the mysteries, all the questions you have about anything related to severe chronic shoulder pain. Okay? And a lot of patients, when they come to me, they are left with option of surgery. Because the medical doctor, they have no way of knowing what's going on. They've done all they can. They don't know what to do. And the only option available is surgery. And I want you to know that there is hope. You don't have to do surgery. There are options out there. There are treatment out there that will help you repair all the damages in your shoulder without any surgery. Okay, so bear with me. This is going to be about an hour and a half approximately video. So I want you to stay with me. You are going to get tons and tons of information. I'm very excited for you because you're gonna get so much information. Okay, so why I started shoulder program? Let me tell you about my history. Ever since I was in college, I began to have pain, unexplained pain. The pain would sometimes be in my finger, sometimes my elbow, sometimes my shoulders, sometimes my neck. And the pain, they run. For example, I will have shoulder pain here, and I will have the pain for a week. Severe pain. I cannot lift my hands up. Even with a little bit of lifting, I have severe pain. And I could not sleep. When I lay on the bed, I have pain, especially when I lay on the side, severe pain. And I can explain, I went to the medical doctor, I have X-ray, I have MRI done, nothing helped. And sometimes the pain will last for a week or so. It shifted to somewhere else, shifted to my knee or to my wrist. Sometimes the shoulder pain will last for half a year. And I thought to myself, I'm gonna get disabled. I will not be able to do anything. And after half a year, the pain just goes away. And it will come on and off like that for years and years. Sometimes pain comes back, sometimes it doesn't. Until I start studying. And the more I study, the more I discover the mystery of the shoulder pain. It's not just a physical issue. There's so many issues that is causing shoulder pain. And I will be discussing every single one of the issues that may or will cause shoulder pain, and you are going to learn every one of them. I will be covering in detail. Again, it's going to be long, but stay with me. Okay? So, we're going to start with case studies. Almost every single shoulder pain patient, when they come to me, I require that they get an MRI, an X-ray. And when the X-ray and MRI is here, I will go through the MRI film with them. I will also go through the MRI report with them. So let me go through 3 case studies with you. And I have the case studies right here. Let me show you in detail. Okay, so case study number 1. Whenever you look at the MRI report, this is the MRI report, you always want to go to the conclusion. Conclusion will tell you what's going on with the shoulder. Okay, so number 1, it says here, there is a partial intrasubstance tear of the supraspinatus tendon. Supraspinatus tendon is the most common injury occurred to the shoulder. If you have supraspinatus tendon tear, your pain, you're going to have severe shoulder pain, and you are going to have pain even lifting up shoulder up this high. You're going to have pain. And a lot of patients, when they come to me, their shoulder is going to go up maximum here, and if they want to try to move more, they're actually not moving their shoulder, they're moving their entire body to try to lift them up, but they cannot. Most important, usually number 1 reason is because of the supraspinatus tendon tear. And let me show you what a supraspinatus tendon is. If you look at the picture here, the shoulder, this is the supraspinatus muscle. The supraspinatus tendon goes from the muscle, attaches to the humeral head of the bone here. When you have a tear, it's always here, always here. If it is a complete rupture of the tendon, you gotta go through surgery. Sorry about that, there's nothing that I can do. But 90% of the time, it's not a rupture, it's a tear. Tendinosis, or a partial tear. If it is a partial tear, you do not need surgery. If the medical doctor says you need to go to surgery and repair that, you do not. There are machines that will repair. There are techniques, there are ways, there are supplements, there are herbs that can repair the tear in the supraspinatus. Okay? The next cause of the shoulder pain for this particular patient is number 2 here. Says there is a edema in the subcortical bone adjacent to the attachment of the supraspinatus tendon, which could represent bony reactive changes related to the tendon inflammation. But this could also represent some bone bruising if the patient had direct trauma to the area. Again, whenever somebody has a direct trauma, either through sports, football, or they tripped, they fall, most of the time it's a complete rupture. If it's not, if it's a incomplete tear, usually it's caused by repetitive movement. You're always moving your arm back and forth. You're always lifting things. You're always lifting heavy boxes, and your supraspinatus tendon is always grinding on the bone, which causes tear. And whenever there's tear of the supraspinatus tendon, there's always effusion or edema. Okay, so edema comes from where? Edema and effusion usually caused because the bursa has been broken. And what is bursa? I will tell you that later on, okay? When the bursa is broken, the water comes out. And when you have a tendon tear also, the surrounding capillaries is going to break, it's going to release water as well. So the whole shoulder is going to be swollen. The more swollen you are, the more inflammation you have. The more inflammation you have, if you do not take away the swollen, the edema, and the inflammation, no matter what anybody could do, the repair will not come in place. The tendon tear will not heal. Will not heal. Okay, we're going to talk about inflammation later on as well too. Okay. Number 3, there is a tear along the anterior margin of the glenoid labrum. What is glenoid labrum? This is a glenoid labrum right here. It's at the surface. This is the shoulder here, the surface of the shoulder. Again, when you have repetitive stress, like fixing a car, like carry heavy boxes all the time, it's going to cause tear in the structure, this is mainly consists of cartilage. There are going to have a lot of cartilage tear, and when you have tear, again, could be here, swollen, inflammation, edema, always accompany the tear, always accompany tear. Number 4, there is a mild tendinosis of the intra-articular portion of the bicep tendon. This is a bicep tendon. This is bicep. Okay? Now bicep tendon is right here. When you have a bicep tendon tear, you have severe pain right here. And when you have bicep tendon tear, you are not going to able to lift your hand up this way. The maximum pump, okay, so pretend you're in front of TV, okay? Go ahead and do this with me. Up. If you have pain right away, right here, you have bicep tendon tear right away. Now again, if you have any pain, let's say if you lift it up this way or this way, if there's pain right away, then you know that the bursa, there's something wrong with the bursa. Either inflamed, either tear, either torn, whatever it is, there's bursa that's broken. Okay, so different movement, we know will cause, is caused by different tear of a different tendon. So again, this movement represents bicep tendon tear. This movement represents supraspinatus tear. This movement usually represents deltoid muscle tear. Okay, so you learn, you know, so you can identify different muscles group by yourself just by watching what I do. Okay. Case number 2. Impression. High-grade tendinosis. Again, whenever you see a tendinosis, always mean there is some kind of injury or some kind of tear. Tendinosis of the tendon of the supraspinatus and infraspinatus without complete tear. Again, supra and infraspinatus. Let me show you what infraspinatus is. At the back of the shoulder, the muscle, this is the infraspinatus muscle right here. This is the infraspinatus tendon. Very, very commonly tear right here. Tear here, the infraspinatus tendon. Let me show you the movement of the infraspinatus tendon tear. If you play golf, okay, when you do golf, you do it this way, right? And you hit the ball, follow through. There are a few patients, when there's a tear right here, infraspinatus tendon, it tears right here. If you do movement this way, it's going to cause a lot of pain just by moving this way. Or if you try to open the door and open the door this way, it's going to cause pain right here because infraspinatus muscle is responsible for this movement or this movement. Okay? Or when you try to pick up something up this way, it's going to cause a lot of pain also, infraspinatus tear. Now there are other muscles around the area, which is teres minor and teres major. They give this is a synergist. That means these little muscles helped. Teres major and teres minor will help infraspinatus to do the same movement. If there is tear in the teres minor and in the teres major, it's also going to cause the same problem in the same movement. Also going to have pain right here as well. Okay? Next, excessive osteophyte, formation of the greater tuberosity of the humeral head and irregular marginated inferior aspect of the acromion, most likely the cause of patient's chronic impingement. Okay, and bone edema of the humeral head. Okay. Again, supraspinatus tear, the tendon here. Sometimes the tear can be caused by the nerve compression as well too. Now we're going to discuss osteophyte because they talk about osteophyte in the report. Osteophyte, another word, it's bone spur. Another word is degeneration. Now if you look at the shoulder here, a normal shoulder, this is a normal shoulder. There's supposed to be a pretty good distance between the humeral head, which is the shoulder here, and the acromion. This is a good distance. This is perfect. If the millimeter is low, very low, for sure there is some kind of degeneration. And we see right here, this is the osteophyte right here. And you can tell that this shoulder, compare it, this is rough, this is smooth. Rough surface always means degeneration or osteophyte. Again, same thing. Rough shoulder, a rough surface right here. Again, rough, irregular surface. And growing of the bones here. Okay, all these are shoulder degeneration. And when you have severe degeneration of the shoulder, the tendon of the supraspinatus or the infraspinatus or any muscle surrounding this area is going to get grind. When I say grind, it means because the space has been small. Every time when you lift your hand up, putting stuff on the shelf, carry boxes, moving things with your head, the shoulder, as they come up, the spaces in between gets tighter. And as you move your shoulder, it's grinding on the tendon. Imagine that. Grinding over and over and over again for years and years and years. Of course a tear is going to come. And if you get treatment, if you do any kind of treatment to repair the tendon without actually fixing the spaces in between, without actually dealing with the osteophyte, same thing, it's going to be useless. The symptom is going to come still, it's going to come back. Case number 3, impression. T1, T2 hypointense lesion attached to or adjacent to the distal supraspinatus tendon, most likely represent calcified tendinitis. So what is calcified tendinitis? This is a calcified deposit here. So anytime any muscle or any tendon is calcified, it's going to cause more tear, going to cause more tendinitis. Tendinitis means inflammation of the tendon as well. Okay, so this is also one of the supraspinatus tendon calcification as well too. Okay. In addition, heterogeneous signal in the distal supraspinatus tendon suggests chronic rotator cuff tear or severe tendinopathy. There is a large subdeltoid effusion noted. Okay, so what is subdeltoid effusion? So this is a deltoid muscle right here, look at that. Okay, when you open up the deltoid muscle, there's a lot of water collection or water effusion is under here. That's called subdeltoid effusion. It's very, very common. Now again, deltoid, if you move your arm up this way, it's caused severe pain, then we know deltoid tendon has been torn, has been damaged as well too. Okay. Now let's go to the bursa. Now there is a lot of bursa in the shoulder. You can see subcoracoid bursa here, subacromial bursa here, and subdeltoid bursa right here. Whenever the shoulder come up a lot, the bursa is going to be grinding, like we talked about, grind against the bone. The bursa is going to have damage, and the bursa will, when there's damage, the water within the bursa is like a water sac, it's like a water balloon. Have you played water balloon before? Right? If you give too much pressure to the water balloon, it's going to burst. Right? So it's kind of similar. So once the bursa have tear, the water is going to come out. It's going to create effusion and edema to the shoulder area. Okay, same thing as this one here too. Okay, and the function of the bursa again is to protect. Is to give cushioning to the muscle and the tendons of the shoulder, so they will not be easily grind. The tendon will not be easily grind. Tendon will not be easily torn or tear. Okay. Now we are going to talk about different possible causes of shoulder pain. There is a lot of shoulder pain causes. Okay, let's go ahead and discuss each one of them in detail. Inflammation. Almost 80% to 90% of the patients that come to me, they all have inflammation. And we talked about inflammation in the previous slide. We talked about it. Inflammation caused by what? Tear. Inflammation caused by torn tendon, torn muscles. Inflammation caused by torn bursa. Inflammation caused by overwork of the shoulder. Inflammation also caused by different diet. If you already have torn, if you already have damage to the shoulder, and if you eat sugar, if you eat sweets, if you eat nightshade vegetables, the inflammation is going to increase. The inflammation is going to get worse and worse, and shoulder is going to get worse. And if you have a lot of inflammation, if you do not take away the inflammation, and you only go to the physical therapy, and they give you exercises, they give you ultrasound, and they give you stimulation, it's not going to help, because ultrasound, stimulation, exercise does not take away inflammation. And if the doctor give you NSAID, cortisone, anti-inflammatory cortisone drugs, that drug in itself, it's not enough to take away the inflammation. It's just not enough. I've seen way too many patients taking the NSAIDs, the anti-inflammatory drugs, just don't get better. Yes, but for the beginning, if your symptom is minor, if your symptom has not been there for years, yes, medication will help for acute cases, definitely, no doubt about that. But for chronic years and years of pain, medication is not going to help, because they're simply not strong enough. And also the pain of the shoulder is caused by so many different layers of problems, so many different layers. If you only take away the inflammation, if you do not take away other layer issues of the shoulder, same thing, your shoulder is not going to get better. So again, inflammation is only one of the inflammation. It's only one of the layers. It's only one of the reasons why the shoulder has pain. For maybe 20% of the patient's shoulder pain, once we take away the inflammation, the pain is greatly reduced. But that's only 20%, 30% of the patients. We talk about sugar being a huge player in causing inflammation. I'm going to show you a video how sugar causes inflammation in the shoulder, how shoulder affects the shoulder so it will not heal, how shoulder interfere with the healing of the shoulder. Please go and see this about a few minutes clip, and after you saw it, I'm going to explain more to you.
The biggest killers in today's world are heart disease, cancer, and type 2 diabetes. And sugar feeds these diseases like wildfire. I took one of my clients, Ryan, to meet my doctor to show us the effects of sugar on the human body. We were shocked by what we discovered. Hey doctor, how are you?
Good, Ryan. Glad to see you.
Great seeing you. Thanks for having us in.
Hi, Jorge.
And tell me how many pounds you've lost now.
I've lost 47 pounds,
And how much sugar you've been consuming about?
about 15 grams of sugar or less per day.
Let's do it. So we first drew Ryan's blood in a healthy state, and then we looked at it under a very powerful microscope.
This is what you want healthy blood to look like. All of the cells are individualized. There's no clumping. You're developing energy. The red blood cells are bringing the oxygen. If they're clumped together, they can't bring the oxygen to your tissue beds.
Right.
So that's important. That is about as healthy a picture of blood as I could ever see. So this is someone who's really cut down on their level of sugar intake.
Whenever you want to see us, right? All right, you guys ready to go eat? All right. Come on. This is where the kitchen's at. So now it was time to eat. So we started to look at some options. And what Ryan ended up eating was just some simple stuff that most Americans would eat on any typical morning. Things you would find in your house and things that parents would be happy to give to their kids. Nothing too crazy, really. Just everyday food. It didn't really look like Ryan overloaded on sugar, but in that course of that small 10 minutes, he had almost 200 grams of sugar. That's a nice snack. Let's see what happens to the blood. All right, well, I'm excited to see this, Ryan. What do you think? What's going through your mind right now? Well, how are you feeling? What do you think your blood's feeling? I mean,
Well, let's see. I don't know, I guess it feels a little tingly up here because it's, sugar at levels that I'm not used to doing anymore.
Ryan, after ingesting 200 grams of sugar, within about 15 to 20 minutes, we take a second sample of your blood. And what we see is rouleau, that's a French word meaning stack of coins, where you've lost the ability to have your energy manufactured in the body. You can no longer bring the energy to your cellular beds. You also have something called spicules. These are platelets which have mutated from their normal disc shape to needle-like projections, giving appearances of cracked glass. There are heavy proteins in the blood, and it slows the liver down due to much fat that develops in the blood.
so when we have this stacking of, and I kind of, don't you think they look like caterpillars?
Look at caterpillars, and the sugar actually does convert in the liver to fat.
Yes, right.
That's what's happening.
So it's like gluing it together with the triglycerides.
Americans are ingesting this tremendous amounts of high fructose corn syrup, along with all of these synthetic chemicals like sucralose, which is Splenda, aspartame. These are toxic chemicals, and their cells are being held together by duct tape. And they don't know it. They don't know it. And when this reveals a very powerful image of what happens to you, this is very powerful.
You think about this, Ryan, when you see this, I mean, what do you see when you look at yourself like a caterpillar?
Well, to look at it as before and then now this, I'm just in shock. And before I started cutting out the sugar, I would imagine my blood looked like that constantly.
Now you have finished watching the sugar DVD. Now you realize if you eat tons of soda pop, Pop-Tarts, bread, pasta, noodles, cakes, your blood is gonna get so thick that the nutrient, the oxygen, is gonna be non-existent. It will not be there. That's the reason why the edema stop. It's not going away. It's not being drained out. That's why your circulation is bad. That's why your lymphatic system is bad. All because of a major sugar issue. So patient that comes to me for shoulder treatment, my requirement is if you want to start program here, you are going to stop all the sugar intake. That's a must. If patients are not willing to stop, I will not take them because the shoulder is not going to get better. If you go for surgery, you maybe feel better for a little bit, pain will come back. Physical therapy is going to come back. Rehab, massage is going to come back. Okay. The next topic is toxicity. Toxin. When we talk about toxin, we're talking about chemical or heavy metal. Chemical toxins such as acetate, the nail polish, chlorine, which found in the swimming pool or in the tap water, food colors, preservatives. Preservative is found in everywhere. If you go to a restaurant, every single dish is going to have preservatives. If you use different sauces, soy sauce, hot sauce, they're going to have preservatives. Cereal has preservatives. Bread has preservatives. Juices on the shelf has preservatives. It's everywhere. Okay, so it's causing a lot of harm to the body. Formaldehyde, they use that to preserve the dead body. Naturally, they also put that in the food that we eat. A little bit of it. Medication, if you eat a lot of medication, the side effect of the medication is considered toxic. Some medication, if you overtake it, you're going to die. You're going to have heart disease. You're going to have diabetes. You're going to have more nervousness. You're going to have more pain. If you are taking medication right now, I want you to stop the video. Take out the list of the medication you're taking. Google every single medication you're taking. Look at the side effect in relation to the muscle, in relation to the spasm, in relation to the weaknesses of the muscle. See how many of the medication that you're taking has side effect to the muscles. If there is, and you keep on taking that particular medication, you are not going to get better. No matter where you go, no matter what treatment you do, you are not going to get it better. The side effect is going to cause more and more injury to your shoulder, to your tendon, to your ligaments, to your bursa, to your muscles, to your bones even. It's going to cause more degeneration to your bones as well too. Okay, medication is considered toxic. Fragrance, body odor, fragrances, the perfume, all those are considered toxic as well. Pesticide, if you go to the market, if you buy food in the market, they all spray with pesticide. Every single one of them. Fruits, vegetables, even meat, they have pesticide. So what can you do? I will show you in a later on video how to take away these toxicity, how to take away these toxins. Okay, plastic. Plastic toxicity, it's actually running wild now because a few years ago there's like plastic toxin all over the news. People are getting it. People are dying from the plastic toxicity. And plastic comes from the plastic bottle. Imagine if you buy the plastic bottle, packages of a plastic bottle, water bottle. Most of the supermarket, they put them in the hot van for hours. They put them under the sun for hours. Of course, the plastic toxicity is going to leak out into the water and you drink it, you're going to get that. If you use plastic container, you put it in the microwave, the plastic toxicity is going to come out. If you use plastic container to drink hot water, you're going to get toxicity. If you get food from the restaurant, they put plastic container and you put hot food in it, it's going to come out. Okay. Heavy metal. Aluminum. Aluminum comes from where? Aluminum toxicity comes from injection. Every single vaccination, immunization shot have aluminum toxicity in there. You can get aluminum in aluminum pen, aluminum foils. All that can come out and affect your body. Arsenic. Arsenic toxin You can find that in every single packaged apple juice, fruit juices on shelf. Imagine if you put these stuff on shelf for 1 or 2 years without getting spoiled. Imagine how much of the arsenic, how much of the preservative they have in them because they don't go spoil. If you squeeze your own apple juice, orange juice, within days, 1 or 2 days they get spoiled. If you put in the fridge, a few weeks they get spoiled, right? How is it possible to have a real, natural juice be on the shelf for 1 year, 2 years without getting any spoil? It's not possible. All those are fake, man-made, chemically made juices. If you feed them to your children, if you drink those every single day, you are gonna get a lot of damage to your muscle. Your muscle is gonna get really weak. You're gonna have tons of sugar, preservative, toxicity in your muscle, tendon, ligament. They're gonna go weak, they're gonna get injured, and they're gonna get torn, and you're gonna have surgery. Okay? So everything goes back to the food, to your daily habits. All right? And there's copper, lead, mercury. Mercury, it's a big thing. Mercury toxicity, it's a huge thing in population. Mercury toxicity is found very commonly in every single patient that I see. Mercury is found very common in tooth, in vaccination, injection, immunization shots. Mercury is a neurotoxin. If you have a lot of mercury, not only will your muscle, tendon, ligament, your nerve get worse, your brain is going to get worse. Okay, because it is a neurotoxin. The nerve, the spinal nerve, the brachial nerve of the shoulder is going to get affected. And once the nerve gets affected, you are going to have more tingling, more numbness in your arms. And once the nerve is damaged, once the nerve is not working right, because the shoulder muscle, they innervated by the neck. When the nerve of the neck, of the spinal cord, the function went down, the shoulder is going to get less and less of the function because the nerve supply is not there, it's not enough. And lastly, MSG. MSG is a huge player because every time patients eat outside, especially Chinese restaurant, and they have tons of MSG, their shoulder pain always come back. Every single one of them, 100%, every one of them. So I tell patients, if you have shoulder pain, if you have knee pain, whatever pain you have, if I were to repair you, if I were to treat you, you are going to stop restaurant food. You need to eat clean, you need to eat good diet. At the same time, I treat your shoulder. At the same time, I repair the damage of the torn supraspinatus, torn whatever it is. If I repair the nerve, whatever I repair, the MSG need to be stopped. If you do not stop MSG, if you have to go to a restaurant, your healing time is gonna stretch much longer. Healing rate is gonna be much slower. It's very important. The next issue that we are going to talk about is the relationship of your shoulder to autoimmune response. Now, what is autoimmune? Autoimmune means that your own body's immune system is attacking your own shoulder. It could be attacking the shoulder muscle, it could be attacking the tendons, the ligament, the bursas, the disc, the bones. If there is autoimmune issue, no matter what you do, no matter whatever treatment you do, you're not going to get better. You're not. Okay, so autoimmune is very important. We got to find that out. If you have autoimmune, you tend to have very chronic. You had the problem for a very long time. It could be 10, 15 years, or it could be 1 or 2 years as well too. Okay, the only way to find out if there is autoimmune issue is whether by blood test or sometimes the pulse test that I do for patients can also detect that as well too. Okay, so every time when we detect if there's any autoimmune issue in response to the blood test, then we have patients do a IgG or IgE testing, or we do the blood in such as white blood cell, red blood cell. We do basophil, eosinophil, neutrophil. That's different type of white blood cell. We also would do phagocyte, monocytes, mast cell, macrophages, and we also test for T and B lymphocytes, cytoplasm, cytokinin, interleukin 1 and 2, T helper cell 1 or T helper cell 2. All these are the list here. It's very important that you get this tested. If there is autoimmune issue, you have to take care of it. Now, if there is autoimmune issue, a lot of time the body will be filled with bacteria. Your shoulder, your muscle and tendon, ligament, sometimes they're filled with bacteria, filled with viruses, or fungus, or molds, or parasites. If you have those kind of autoimmune issue, those immune germ issue, then you gotta take care of it. Okay. Now, and other than the blood test, there's another way we call a live blood test, which I'll explain to you in detail later on. You'll do a drop of blood, and we see the blood in the microscope, and therefore we can see a lot of different kind of germs in your blood as well too. Okay. Again, if you have bacteria, virus, fungus, or parasite affecting the shoulder, causing the shoulder not to get better, then we have to give you some supplements, some herbs to kill those bacteria or viruses. Okay. The next topic we're going to talk about is pH. Again, when your shoulder, when your joint or joint capsule, when the acidity of the shoulder joint are way high, when it's too acid. When it is too acid, it causes a tremendous amount of pain. If there is a lot of acidity, then we would tell patients to either use alkaline water or use lemon. Both of them would kind of decrease the acidity of your shoulder. The acidity could be tested by if you put a pH strip into a mouth, or you do a pH strip in urination. You can tell if your body is more toward acidic side or toward more alkaline side. Okay, there is a picture I want you to see. Okay, now if you look at the picture here, anything more acidic, it's going toward either 1.5 or -3. Gastric acid, battery acid, those are all very, very acidic. Okay. Coca-Cola, vinegar are very acidic. Now, basic alkaline such as household lye, bleach, salt water, intestinal juice, blood, they're more alkaline. Okay. Now let's read the statement here. When your pH is out of normal range, all sorts of bad things happen. For one thing, disease-producing organisms thrive. This explains why some people exposed to certain bacteria or viruses get sick while others do not. Acidic conditions can cause muscle to constrict and inhibit the exchange of nutrients and waste product in muscle cells, causing fatigue, soreness, and pain. In fact, a pH imbalance affects all cellular activity in the body and can lead to a wide range of disease and symptoms. Okay. Another big issue in regards to chronic shoulder pain is the nutrition deficiency. Just by pulsing or sometimes by blood testing, we can tell if your muscle is missing certain nutrient, if the ligament is missing nutrient, if the tendons, the bones, the joint capsule, if the fascia around the shoulder are missing certain nutrient. If the nutrients are missing, then your shoulder is more prone for injury, more prone to tear, more prone to spasm, more prone to weaknesses, okay, and also more prone to your joint get misplaced as well too. So we gotta give nutrient. The body needs nutrient. These nutrients such as vitamin A to Z, could be found in the multivitamin, or sometimes specific vitamins such as vitamin C or vitamin D, very, very important to this structure of the shoulders. And minerals as well. Minerals such as you can find very, very rich mineral in seaweed, alfalfa plants, and eat those and mineral to replenish the nutrient in the muscles. Now, amino acid is one of the biggest missing nutrient in people, because a lot of patients when they come in, they are either vegetarian or they don't eat meat that much. People that does not eat meat, vegetarian, usually do not get enough amino acid. Therefore, they get a lot more damage to their muscles. They get a lot more injury when they fall, when they lift something heavy. Okay, so it's very important issue. I always stress that to every single patient. Nutrient. Gotta have nutrient in order to repair. Gotta have nutrient in order for you to stay off pain. Once pain is gone, once you're repaired, gotta, the nutrient will maintain you basically. Okay. Now there are also another issue of the pain causing chronic pain is the relationship of the organ in relation to the shoulder. Okay, the stresses in the organ. Now, for example, patients that tend to get fearful, they're very fearful of maybe their husband, their wife, fearful of money issue, fearful of government, fearful of jobs. People who fears more, the fear has a relationship with the shoulder according to the Chinese medicine. To the kidney. Now, if the kidney is weak and you have a lot of fear, and sometimes this emotion will get to the shoulder. This stress will build up in the shoulder, built up in either in the muscle, in the joint or joint capsule, whichever it is. If you do not take away the stored stress, the emotion in the shoulder, sometimes the shoulder will never ever get better. Never. Okay, I've treated tons of these kind of stress, emotion-related pain to the shoulder, either the shoulder, neck, body, fingers, headache. Once the emotion is gone, once the stress level is gone, the pain sometimes most time it's instant. Instantly, they can raise their hand up. Instantly. Well, not everybody, some patient, but we gotta look at this factor. Okay, so different organs. Let me show you the picture. Different organs shows different emotion. So, emotion of the liver is anger. Emotion of the heart is hate, overjoy, impatience. Emotion of the stomach or spleen is anxiety, worry. Emotion of the lung, large intestine is it's grief. Okay, emotion of the kidney is fear. Okay, so like I said, the Chinese pulse will tell me which organ have issue and which organ has emotion, and we gotta deal with that. Okay. Now we're going to talk about different organ, how organ affects the shoulder, not just the emotion, but the organ in itself. There is refer pain. I'm not sure if you heard of it. If you have kidney issue, if there is any kidney issue, then you might have back pain. If you have heart issue, the pain refers to the shoulders. Okay, so stuff like that. So we got to look at the organ to make sure every single organs of your body are healthy in order for your shoulder to become very healthy as well too. Okay. Circulation, lymphatic system, it's a huge thing. There's a big difference. Let me show you. Most of the time, people do not know what lymphatic system is. Okay, it's a difference. Now, if you look at this is the blood system, circulation. There's artery, there's vein, it circulates all over the body. Likewise, the lymphatic system. Lymphatic system also all over the body. Lymphatic system is responsible for draining off unnecessary toxin, unnecessary inflammation, unnecessary junks from your organs, from your muscles, from your tendons, from your brain. I mean, every single structure in the body, in the cell that has junks, that has garbage, the lymphatic system just draining it away, draining it off. If your lymphatic system is not working, if your blood system is not working, it will not carry off garbages. And the toxicity, the garbage is going to stay in your blood, in your system, in your muscle, in your tendons, your organs. It's going to cause major, major damage. It's going to cause major issue. You're not going to recover, first of all, most likely, and the treatment is not going to be useful. Any kind of treatment. Medication is even make it worse because medication is full of toxicity. Medication just made from chemical, they are so harmful to the body. It adds more weight to the lymphatic system, adds more weight to your circulation. Okay. And of course, if you have that kind of issue, then there's a way, there's a machine to help you drain the lymphatic system, help you drain the blood circulation. There's supplement, there's herbs. It's very easy to handle these kind of situations. Very easy. Okay. The next item, the next topic is going to be inflammation, food, diet. Every single time patient comes for treatment, every single patient will ask me, what should they eat? How do they eat? And every time when a patient comes in to see me, I will give them a list that they can or cannot eat. This list is not really for everybody, but generally, when you have a lot of inflammation in your muscle, tendon, ligament, or joints, you gotta have to avoid certain food, such as sugar, which we talked about before. Okay, wheat, gluten. Okay, you gotta avoid nightshade. That is one of the major food that will cause inflammation, that will cause joint pain, and almost nobody knows about that. Almost none of the doctor. And once you start avoiding this kind of diet, your pain sometimes just goes away by itself. Sometimes it's reduced by maybe 20-30% just by avoiding the diet. Okay, so I want you to. What is nightshade? You should Google it yourself. Really, let me show you here. Now, nightshade vegetables such as, it could be, potatoes, tomatoes, yams. It says here pepper, red pepper, yellow pepper, chili pepper, cayenne, tomatoes, eggplant, paprika, all these. And you should read this yourself. Pause it and read this. It will give you a very good explanation of what nightshade is and how it affects your body as well too. Okay. All right. Next item. Now, the next item we are going to talk about structures. Now, another issue of shoulder pain, it really is coming from the neck. If you have a compression of the neck nerve here, now the compression will cause shooting pain down to your shoulder, also down to your arms or hands. Okay, if you have that kind of transferring or referral pain, then we have to treat the neck. Or sometimes the pain is not coming from the neck, sometimes it's coming from the ribs. Then we gotta fix the ribs. In fact, we gotta fix the muscle here. Let me show you the films here. The slides here. Okay. Now, if you look at these, shoulder pain could be caused from the neck. Sometimes could be caused by the herniated disc that might have compressed on the nerve and causing shooting pain down here. If you look at the anatomy, all the nerve of the shoulder and the arm, the hand originate from the neck right over here. Okay, different nerve compression will cause different area of pain, either the shoulder or the arms. All right. Now, all these could be easily determined if you come. Every single time patient come in for the first time, I always offer a free consultation. It's always a free consultation again. Come in, I determine what's going on for you, and you decide if you want to get treatment or not. Okay? All right. Now, another big issue in regard to the muscle pain, the shoulder pain, the chronic pain is your brain. Now, most people do not know, most doctors do not have this kind of knowledge. But just think about this. What moves the shoulder? I always ask patients that, and they always answer me, it is the brain that moves the arm, the shoulder, right? It is not the muscle by itself, because the brain sends down the message down to the muscle. The brain sends down message to the tendons and ligaments. So you can start move. this way or that way or that way. So if the pathway of the brain is blocked, then the activity of the muscle is greatly diminished. So we gotta activate the brain. And there are ways of which I will show you later on. If there is a brain issue, how we go about treat it, how we go about detecting the brain if there's an issue. Okay, and how we go about solving this issue. We're going to talk about all that later on in the slides as well too, on the treatment method. Okay. Again, the food allergy, when patients have issue with shoulder pain, no corn, no soy, no wheat, no dairy. This is the basic one. Basic. Avoid all these first. But again, everybody's different. I gotta test to see which one is that you cannot eat. Okay. Now, if you do have an allergy issue, and of course, we offer a blood test. Not here, but we write you a prescription to get the blood test done. And there is a panel we call a California Allergy Panel, which you test it. It will test entire body of your IgG, your IgE, your immune system. Also, will test what kind of food you're allergic to. Are you allergic to corn? Are you allergic to soy? Are you allergic to wheat? Are you allergic to wheat? Are you allergic to grass? Are you allergic to pollen? Every single allergic reaction most likely will affect the shoulder as well too. Another possible cause of the shoulder pain is bad habits. People sleep on the side. That is the worst habit to be in, which most of the time is the worst habit that causes shoulder pain. Okay. Because when you sleep on the side, your head is tilted 8 hours a day. Your arms are squeezed up. Your ribs get mashed up. Okay, so I always tell patients, no sleep on the side. Your working environment, you work, and let's say you work as a nurse, you always carry patient with this arm. Always carry patient with the wrong position, with the wrong force. Okay, on and on, ongoing bad habit in working environment will cause a lot of damage to your shoulder. So I always tell patients, if you have an issue with the work habits, either you're going to change work habits or rest maybe a month or two. Okay, that's how you get better. Because if you do not rest and we treat, you get damaged, you treat, you get damaged, you never ever get better. Right? Last but not the least, cancer issue. What I have found over the years that patients have cancer, they cause pain. Cancer causes pain. If you have cancer in the blood, cancer in the lymphatic system, they will cause pain in the shoulder. They will cause pain in the muscle, and the pain is unexplained, and pain is not treatable. If you have cancer issue, you gotta go to the cancer specialist. Okay. Of course, we'll find out just by doing MRI, we should be able to find out. Just by doing the pulsing, we should be able to find out if you have any kind of cancer issue or not. All right. Now, you have heard all these different reasons, all these different causes. Now, when I treat patients, I always tell patients at the beginning, I look at your body like an onion. Just look at the picture here. Okay, onion. Why? Because layers. There are layers upon layers upon layers upon layers of issues. Just the shoulder by itself, just think about shoulder. There's so many different structures in the shoulder. For example, if I found out that, let's say you have multiple issues. You have issue with the shoulder muscle, you have shoulder with the tendon, the ligament, the bursas, the nerve. You got problem with everything. Okay, let's just go to the muscle alone. Muscle in itself alone have issue with food, issue with allergy, issue with toxicity, issue with autoimmune, issue with the blood, the lymphatic system. Okay, so we're peeling off layers as we check your body, as we check the shoulder, as we treat the shoulder pain. We're taking layers and layers and layers of different things away from the body. That's how you get better. Okay, so always think of an onion analogy. So let's say, for example, inflammation could be the first layer. Toxicity could be the second layer. Nerve damage could be the third layer. Autoimmune could be the fourth layer. So that you take out one by one. When all the layers are gone, when all the onions are gone, your condition is going to get better. Your treatment, your shoulder is going to get better. Okay, for sure. For sure. And this is what most doctors do not do. They don't check for layers. They just check one thing. And then if they cannot, they treat you for that thing. If it doesn't work, they refer you to another specialist. Another specialist, all this testing cannot find out, they refer you to another specialist. And none of the specialists ever look at the shoulder pain in regards to the whole body. Never. They never look at the shoulder in regards to the food, the work environment, your thoughts, your emotion, your stress level. Hardly any doctor look at all the thing in relation to the shoulder, but I do. I do that for everybody, every single patient. That's why patients, when they come in for treatment, they all spend a long time, every single one of them. We spend a lot of time with patients in detailing them, in checking them in detail. Every single session they come, I personally check with them every single layer to make sure that the layer is gone. Then we go to the next layer. Just keep on checking, keep on taking care of the layers. Okay, that is really the only way to get better. Only way. Okay. Now we're going to talk about different diagnoses, different way to check. All right, to check for different things. Now, whenever you have a shoulder issue, always do MRIs. Always. If you have a simple shoulder, you're not going to come to me. Not really. You're going to go to a physical therapist, and you're going to go to a massage therapist. You're going to get better. Okay. Patients that come to me are those that do not get better with everybody else. Those that patients are having problem for 5 to 10 years and have tried everything and it doesn't work. Those are the patients that I take. Okay. If you are one of those, you gotta do MRI of the neck and the shoulder. You gotta do X-ray, neck and the shoulder. Gotta do blood tests. Okay, we talked about it before. Blood tests for the complete blood test, red blood cell, white blood cell, glucose. They check for liver, kidney, check for thyroid, check for autoimmune, check for inflammation, check for homocysteine, uric acid, methylation, food sensitivity testing. And you gotta do the live blood test. You prick a blood to see if there's any bacteria, virus, fungus, parasite. Then we also offer some neuro exam to see if there's any issue of your shoulder coming from the brain. Okay, the neuro exam does that. Okay, I'll discuss with you when you come over. And there's Chinese medicine pulse, which I will also do that with you to pulse to do your pulse to see what's going on with the whole body as well too, which I will discuss it more later on. You're going to be doing surface electromyogram. Okay, well I'll show you what that means. Okay, so again, let's go a little more detail in each items. If you do the blood test, CBC blood test, glucose, sometimes if your blood sugar is high, then we determine that by HbA1c. When we test for iron, now if you have extreme maybe arthritis in your shoulder, then we check for RA, NA, ESR, uric acid, homocysteine. These are the inflammation marker of the shoulder. Okay, we check for electrolyte panel to make sure you have enough nutrient to your muscles. Okay, we check for liver and kidney, AST, ALP, BUN, to make sure that your liver and kidney are doing well, they're functioning well. Okay, so we take away the toxicity, that issue. Sometimes the thyroid would cause pain to the shoulder. Sometimes it does. So we check T3, T4, TH, and TPO. TPO means the autoimmune issue that may have affected the shoulder. Okay, we check the lipid, we do another California allergy panel, which is, we talk about different food sensitivity. We check the egg, the soy, the wheat, all that good stuff. Okay, we might do thyroid testing if you have further issue with autoimmune issue. So thyroid testing is specially used for autoimmune, which we discussed before. Okay. Now this is the live blood test we talk about. You prick a little, patient, you can do that yourself. You do a little, prick a little hole in your finger, and then one drop of blood come out, and we look under the microscope, right? And the microscope is going to show that this, for example, this is a normal red blood cell. This is a messed up red blood cell. Okay. This is a red blood cell that's all clumped together because you get a really bad diet. Okay. This is uric acid. If you have uric acid in your joint, we'll pick it up in the blood as well too. If you have any bacterial infection, viral infection, parasite, fungus, it's going to show up in the blood. It's going to show up in the blood as well too. All right, this is a great test, really wonderful test. Okay, this is a surface electromyogram. So this is how it is done. There's a machine that we run through the entire spine, and with each section, the computer is going to pick up problem area. If any area have red, then we know there is an issue in regards to spine. We do this only if we want to determine that if the shoulder pain is coming from the neck. This is one of the way to determine. Okay. All right. We also do some neurological exam during when you come for the free consultation as well too. The neurological exam, very simple. Basically, what we do is patients sit down here, and then I get a tuning fork, right? And I would test one finger against the two shoulder to see if all the sensation of the finger and shoulder are normal. If they're not, there's some nerve blockages for sure. Okay. I also do 2-pointing, such as I would, 1 point here, and you tell me how many points I'm touching. So if it's 2 point, okay, 3 points. So this is just testing sensations as well. Okay. And I will also move your finger in different direction to see if you can feel the spatial sensation of the fingers. All right. If you cannot do these, if there's no feeling of fingers, we know for sure you got an issue with the brain, a nerve for sure. So we got to deal with the nerve, either the brain or the neck. Okay. Okay. So before we start doing any kind of therapy in regards to showing you what kind of modality to use for your shoulder pain, we're going to show you how we pause, because pausing for us is a kind of examination that tells me, the doctor, of what's going on with your body and how we are going to treat, what machine to do, what supplement to do, basically direction of the treatment of the chronic shoulder pain. So pausing, like we said before, it's a 5,000-year Chinese history pausing. So what I may do for you, because every time you're going to come to this room, okay, first, and then you're going to be sitting down on a chair, and I'll be touching your pulse right here, either this or this pulse. When I test the pulse, things will go through my mind, and analysis will go through my mind. I'm gonna explain the series of analysis that go through my mind in regards to treating the shoulder issue. Okay, so the very first thing, when I pause the shoulder, I will first of all see which structure has issue. For example, if I touch the shoulder, I have to determine which muscle. Is it a supraspinatus tendon? Is it a deltoid issue? Is it a infraspinatus muscle? Now, if it is a supraspinatus muscle, which is the most common injured muscle for the shoulder, which I show you already in the MRI, the report and also the film, the injury to the supraspinatus tendon. Okay. Now, if that is the issue, then I will pause the body to see what's going on with the structure. Is it a muscle issue? Is it a tendon issue? Is it a ligament issue? Is it a nerve issue surrounding the area? Is it a fascia? Is it a bursa issue? Or is it something to do with the lymphatic system, or is it blood circulation issue? And pausing will tell me, first of all, which structure it is having issue for. So once I determine structure, for example, I determine it is a muscle injury. So then I go into deeper testing to see what kind of injury. Is it a tear injury? Is it a adhesion? Is it a spasm? Is it a movement of the muscles and tendon ligaments? That's how I do that. And the next category, because when I do pausing, I do categories. The second category is, I call it a chemical category. Now, chemical category, I will see if the muscle, for example, muscle of the supraspinatus is inflamed. Does it have involvement with the sugar issue, involvement with the toxicity issue? It could be that your cell structure is not doing well. It could be that this might be some bacterial infection, virus infection, fungal infection. There might be also pH issue, like we talked about in the previous slides. There might be alkaline, there might be acidity issue as well too. And I also check if there's any nutritional deficiency. If there is nutritional deficiency, then which nutrient is missing from the muscles? Is it calcium? Is it mineral? Is it amino acids? It's a lot of different nutrients might be missing from the muscle, and all that can be done with pulsing. Okay, and the next category thing is the emotion, which I also mentioned before. If you have a certain emotion that is associated with the muscle, let's say for example if you have a lot of anger in your life, then your liver might be an issue associated with your shoulder. Then I take away the emotion issue of the anger that is trapped in the shoulder. And a lot of patients, quite a few number of patients, when they have shoulder pain, and we've done everything. We've done the modality to repair. We've done inflammation, take away all that, take away the inflammation and toxicity. They still have pain. Then we address the emotional issue. When the emotion or the stress is taken away, the shoulder pain, it's gone, almost immediate. Okay. And the next thought, the next category is electromagnetic field. What that means is people carry cell phone. We have patients that carry cell phone in their pocket. And every time they put cell phone in the pocket, they will have leg pain and numbness will go all the way down. And once I found out that the cell phone is causing the physical issue, I tell them take it out. Then right away, within 1 or 2 days, the pain, the numbness, tingling, it just went away. Same thing with the shoulder. If you're carrying cell phone all the time, beeper all the time, in your pocket or in your front pocket, it could be one of the reasons that may have caused your shoulder discomfort. Okay. Now all these are different layers. So we want to make sure that anything that may have caused a shoulder issue, may have interfered with the healing of the shoulder, we have to take them out layer by layer, one by one. Okay, there might be organ issue, there might be thyroid that may be associated, there might be a kidney associated with the shoulder, there might be heart associated with the shoulder. If there's an organ, we gotta we're gonna address the organ issue as well too. Okay, now organ, not only can we pause the organ issue, you can also do blood testing to determine what's going on with the organ issue as well. There might be certain allergy issue associated with the shoulder, allergies such as food. And we talked about diet before. Food that may have caused inflammation such as sugar. If you eat too much sugar, you may have more pain. If you eat certain food, we talk about the nightshade vegetable, potato, tomato, black pepper may have caused it. For myself, when I eat mushroom, when I eat asparagus, my shoulder would pain that very night. Right away, and I will not be able to move my shoulder all the way up this way. I will not be able to. And if I don't take supplement to drain away the toxicity, the sugar, then the shoulder pain will stay with me for at least a month or maybe half a year if I do not take care of it. Okay, so that's a certain allergy. If you have an allergy with the food, then there is, other than the pulse testing, there's a blood test with IgG, IgE. There's also different food sensitivity tests with the blood test that you can do to get a complete overview of what kind of food that your body or your shoulder is allergic to. Once we take away the allergy to the shoulder, allergy of the shoulder to the diet, then once we treat, when the pain is gone, it's gone. It will not come back unless you keep on eating the wrong food, the wrong diet. Okay. There might be also referral issues such as the shoulder pain could be coming from the neck. So I have to pause that as well. Is it coming from the neck? C1, is it from C3, C4, C5, C6? Or is it from the shoulder? Is it from the rib? When we pause, then we can tell. And when I touch the neck, then I can tell what's going on with the shoulder if it's referred from that area. Another one is the Chinese medicine theory, which I incorporate, such as the 5 elements of Chinese medicine: the fire, the wind, the water, the dampness. Is it because the blood clotting? Is it because the qi is not enough? Your yin-yang issue? All that could be causing the stagnation and accumulation of bad energy in the shoulder. And that needs to be taken away as well too. Okay. Another issue is that we pause is the brain issue. We're gonna show you all the different way to treat that. Of course, when we pause it, we need to determine if the muscle of the shoulder or the supraspinatus is coming from the brain. Could be the brain in the front, could be brain in the back, brain on the side. The pathway, we call it large diameter pathway. When the pathway is blocked, the signal from the brain cannot be sent down to the muscle. Therefore, the muscle will not have enough signals. Therefore, the function and repair is going to be very limited. So we got to open that channel, that large diameter afferent pathway channel as well too. Okay, and there's other little stuff which when you come here, I will pause for you to see what interferes the healing of his shoulder. Okay, so once I finish pausing, then I will determine what's going on with the shoulder, what kind of supplement you need to take, what kind of herbs you need to take, if you need to sleep better, if you need to sleep more, if you need to stop working, and then I will determine what kind of modality or machine that we're gonna do for you to repair the shoulders. Okay, so let's go ahead and go to another room. I'm going to show you different machines. The next modality that we're going to use for your shoulder pain is K-laser. Now, K-laser is an incredible modality that increases heat in the shoulder. Let's go ahead and have you show this one here. Now, this machine is incredible in a way because the laser will penetrate very deep into the shoulder and repair that tear that it is shown on the MRI. So what we're going to do for a patient is, first of all, we're going to set to the shoulder. Okay, it's going to give us protocol, and we need to know if the shoulder has been there for a long time or is it a new injury. If it's a injured shoulder, it's been there for maybe 2 or 3 years, then we go to the chronic. It could be chronic high, chronic low, usually chronic high for very severe patient shoulder pain. Then we're going to go ahead and press start, and then the laser is going to come off the head right here. Okay, and press the button here. The laser ready, and the laser light right here. Do you see that right there? Now the red light, it's a heat. It's very hot. If you don't move around, it's gonna burn through a hole into your skin. This is a very high power laser. And what this does is we're gonna basically run this around the shoulder. Okay. So run around whatever the injury. Let's say, for example, the supraspinatus muscle has tear. So we're going to run this along the tear area of the shoulder. It depends how severe. The least we do 5 minutes, maybe at most maybe 10, 15 minutes. It depends on the extent of the injury. Now this machine has been working extremely well. Of course, this is not a standalone. We do a lot of other machine, but this alone is worth that money you spend, because this has basically show us a lot of incredible result with just this machine alone. Okay, all right, so next machine we're going to do is K-laser. It's the corneal laser. Okay, so a corneal laser, this is a low level laser, means that when the laser is light up, you can see the light right here. When the laser shine into your skin, no matter how long the laser stay there, it's not going to burn. That's why it's called a low-level laser. Now, low-level laser, even though it doesn't penetrate as deep as the other K-laser, the high level, still the repair, the rate with which it repairs the muscle is incredible as well too. Now, that because it doesn't burn the skin, that's why we put the corneal laser on the muscle, the injured muscle, usually for 30 to 60 minutes. Okay, if you go to the doctor that use this laser, sometimes they do 1 or 2 minutes. At most they do 10-15 minutes. Not really not enough. If you have a severe muscle injury or tendons or ligaments or whatever injury in your shoulder, you gotta do at least 30 to 60 minutes of the laser here. Okay, amazing result we got with this machine as well too. Okay, so next machine that we do for patient is it's a combo unit. Okay, so we put this pad on patient's shoulder. Okay, for example, if you have pain, okay, pain right here, Then we put 4 pads. Okay, 1, 2, 3, 4. So we make sure the pad will give you the approximate area, and the machine is gonna give out different signal to the muscles, the bones or ligament to start heal the area. Now there's different options. Okay, IFC, there's Prima, there's Hyvo, there's Russian. If you go to most other doctor, most of the time all they do is TENS unit. TENS unit is the least amount of, is the worst kind of treatment for patient because it's practically useless. TENS unit basically just improve inflammation, improve the circulation only. But this 4 different, it depends on different injury. If you have severe injury of the muscle, tendon, ligament, like a tear, then we most likely use the IFC, interferential. If you have severe nerve tear or nerve compression or nerve tingling and numbness sensation on arm and shoulder, then we use Prima. If it's severe inflammation, we use Hyvo. If it's a, like blood clotting or the fluid's not moving around, then we use Russian to open up all the channels, okay, of the shoulder. So again, this is a very high-tech machine. Most other places, the machine they have is very old. It's been 10 to 20 years. This is a very, very high-tech, very brand new machine that we have here in our clinic. Okay, very, very effective as well. And when we do this treatment, this pad treatment, we don't do it just for 10-15 minutes like other physical therapy and other clinic do. We do 30 to 60 minutes, depends on the severity of the shoulder issue. You gotta do that long in order to get a really, really good results with patient. Okay, all right. So when your shoulder gets better and better, eventually we will cut down to 10-15 minutes. But at the beginning, we will not do that for patient. Okay. The next therapy we have is called a Rife system. The Rife system basically is, it's a system where we, for example, if patient have a lot of inflammation, then we're going to program the Rife system to give the signal of inflammation. So if we set the inflammation signal, then the signal is gonna come out of the tube right here, okay? And the signal from the light is going to help dissolve the inflammation away from the shoulder. Okay, so there's different programming. There's different frequency for different conditions. It could be circulation. If you have bad circulation to the shoulder, there's frequency for that. If there's a muscle tear in the shoulder, there's frequency for that. So this is very good for fixing any kind of internal structure of the shoulder, as internal and external structure of the shoulder as well too. Okay, good. The next modality to fix the shoulder with is we call orthostam. If I determine your shoulder pain is coming from the neck or is coming from the ribs here. For example, if your neck C5, C6 has a impingement of the nerve because the bone is shifted. If the ribs is shifted and causing compression on the nerve, both of which can cause shoulder issue. So what I'm going to do, I will use the orthostam to move the bones of the ribs or move the bones of the neck as well too. And of course I will palpate to determine what section of the impingement of the nerve is. And again, if your condition is primarily compression of the neck and nothing else, then you usually get an instant relief of the shoulder pain, usually. Okay. Now, next machine that we use, this is a very deep vibration treatment. What this does, it breaks out the adhesion. If you have a shoulder injury, you've been having it, for example, if you work as a nurse and you carry patient all the time, you dress patient, you change the bed sheet, you carry heavy things, and you take care of patient every single day. You're going to use your shoulder every single day. And your shoulder is already hurting, okay? And you rest it, you feel better. And you work again, and it hurts again, and you rest, and it gets better. Every time you rest, the shoulder heals. The scar forms. And you do the patient, and then the wound opens up, and you keep on doing that for years and years and years, of course, a scar is going to develop, right? When a scar forms, it's not the scar tissue and muscle. It's going to be a total two different structure. If you have scar issue problem, your injury is going to be much faster. Your injury is going to be very unstable. Okay, so in order, if you have this kind of issue, then we got to make sure we take away the issue of the scar tissue, so or the adhesion or the spasm. Then we use machine to run the vibration around the scar area. And again, once the scar is broken, you're gonna feel the instant relief in your shoulder as well too. Instant, okay? For this particular treatment protocol that we use for your shoulder, chronic shoulder pain, is we call it neurofeedback system. Now, if I checked your pulse, if I checked your body, your nervous system, your brain, and your muscle pain, the shoulder pain is because of the brain interruption. Because we showed you before that the pathway of the large diameter pathway from the brain to the shoulder, if there is a disconnection of the nerve pathway, then we gotta deal with the brain. We're gonna use machine to basically open up the brain channel, the nerve flow, so the muscle can start getting the healing. Okay, so what we do for a patient is we're going to use different electrode, and we put on different parts of the brain. It could be this 2 point, could be this 2 point. It depends on what I test. So if I figure out that your supraspinatus muscle is caused by C3, C4 point, then we're going to put the electrode on a C3, C4 point, and the computer is going to analyze your brain condition. Okay, and then we're going to use the computer to treat the nervous system of the brain, so to open up the nervous system of the brain. So the brain signal could be then transferred to your shoulder, then the healing will start. Okay, and we have successfully used this to treat a lot of different conditions. Could be shoulder, could be the knee, could be the back pain, neck pain, could be headache, and this machine we have had incredible results with this modality. The next modality for your shoulder, chronic shoulder pain is we call it DRX 9000 spinal decompression machine. Assuming that your shoulder pain is a result of the compression of the nerve from your neck, whether C5, C6, whether C3, C4, C6, C7, it doesn't really matter. If the compression of the nerve comes from the neck and shoots down to the shoulder and causing severe shoulder pain, which happens a lot. And usually when you have this kind of shoulder pain, the symptom is not just one shoulder, it's sort of the entire shoulder. Sometimes it runs around, sometimes in the back, sometimes in the front. Okay, and the DRX 9000 decompression will actually work on your disc here, or for example C5, C6 disc herniation. It's going to open up the disc herniation and it's going to relax this, let go of the nerve compression, and when the nerve compression is let go, the nerve pain down the shoulder is going to be gone. It's going to be gone. Most of the time when patients have severe shoulder pain, they also accompany numbness of the entire arm, and this is always a result of the disc herniation on C5, C6. Okay, this machine is primarily to fix your disc herniation without the use of surgery or injection. Okay, so this is a very good machine for that. This particular modality is called HIFOMAT. Now we use this one for chronic shoulder pain if we found out that the patient's shoulder pain, whether the muscle, tendon, or ligament, has some kind of inflammation or toxin which is accumulated in their muscles, tendons, or nerve. And if there is a lot of those inflammation and toxicity, then we use this machine to basically drain off those toxicity away from the body into the lymphatic system. And this machine basically goes along the lymphatic system to drain out all the unnecessary toxin or the waste product from your body out to the poop or your pee. Okay, so a patient basically holds the metal pieces, and then we run this the handle here right along their shoulders. And when you have severe inflammation or toxin in your shoulder area, then you're going to feel a lot of tingling of the metal pieces right here, and which is this is telling your body that you are detoxing at the same time the body, at the same time the shoulder is being healed. The next modality to heal the shoulder, chronic shoulder pain, is a wave vibration machine. Now, most of the time when we use this particular treatment is when patient's shoulder is getting better. When the pain is getting less and less, when the range of motion is getting more and more, and we want to strengthen the shoulder. For example, if you carry mails, if you are a nurse, if you are a construction worker, you need to be strong, or else when we heal you and you go back to work, and right away the pain is going to come back to your shoulder. So we're going to use a vibration to help you facilitate the strength, facilitate the treatment, so the strength of the muscle will be strengthened, will be maintained. Okay, so when you go back to work, you can be strong again. You won't get injured as well. So in order for the muscle to be strong, there's a lot of different ways that we can do that. So one of the way is to rehab. Another way is to take in the right supplement. Another way is to take in the right food. Another way is to make sure the nerve system from the brain, from the nerve, is fully giving the signals that the shoulder needs. Okay, when everything comes in place, the shoulder is going to be really, really strong, and you're not going to get injured at all whatsoever. So when we do this, you see this 3 oxygen chamber right here. So we have patient hook onto the oxygen and exercise with the shoulder on a plate at the same time. There's various exercises that we do, that we have patient do with this machine. Different patient requires different exercises, and those kind of exercises, when you come in, it's really different from everybody. It's tailored to everybody. So some patient could be you sit here, you put your hands on the vibrating machine, and move your shoulder backward or forward. One could be you stand on the machine and you do different training different muscle, the bicep, the tricep, the deltoid muscle. You train that as well too. You could be that you're increasing the range of motion while you do the vibration treatment. Is you vibrate and you stretch at the same time. Stretch could be stretching the pectoralis major, you could be stretching the infraspinatus muscle, or the serratus anterior, or the teres minor and major. You could be stretching this way as you put yourself on the vibration to stretch the supraspinatus muscle. You could be sitting on the machine where you stretch the neck to stretch all the muscle in the neck which attaches to the shoulder. Okay, so that's what we do for patient for the rehab, and patient always do this usually about 10-20 sessions for us, just for this as well. And after they're doing really, really well, and we release them, and they can go home. They don't have to come back again. So after listening to an hour or so information, tons. I know it's tons and tons of information. Hope you absorb all that. If you do not absorb all that information, you gotta go back and rewatch it again. Okay, that's a lot of information. If you did finish all those and listen to all those, I want to ask you if you are ready to make a change. Are you ready to change your life? Are you ready to be able to pick up your son, your daughter? Are you ready to go work on your yard? Are you ready to be able to fix your car? Are you ready to be able to dance? To use your arm and to go up and down and just do exercises. Are you ready for that? If you are ready, then give us a call. We offer a free consultation that we discussed. You get free consultation, okay? But before you come for a free consultation, I gotta make sure that you are ready. Most likely, I will ask you from 1 to 10. 10 being willingness that I'm going to do everything I can to get me better. Okay, if you have that mentality that I will do everything I can to get better, then you're welcome to come for the free consultation. If you're wishy-washy, if your shoulder is not that bad, don't have to come. Just wait. Go somewhere else. I always take patient who is serious. I only take patient who is serious about their condition, who want to get better. Okay, now I will explain to you when you come that you will need to take supplements. You will need to take herbs. Why? Because we discussed that nutrient. Your body needs nutrient to heal. The only nutrient that you need if you want to heal fast is by supplemental herbs. Okay, so you gotta be willing to do that. You gotta have your support of your spouse, your wife, your significant others have to be with you for the free consultation. They have to be here. Then they understand. Then they will support you mentally, financially, physically to help you get through the pain of the shoulder. Okay, it's very important. You got to get your spouse out. All right, you got to be able to willing to change your living habits, your eating habits. You got to be able to stop certain food. You got to have that because a lot of patients when they come, they're not willing to stop certain diet. They're not willing to give up their Gatorade. They're not willing to stop their coffee. They're not willing to stop eating bread. I'm sorry. Then don't come. Do not come. We are not welcome here. Because if you do not stop those kind of food, there's no way that I can help you. Even if you do surgery, it will not help you because it's always going to come back. Always going to come back. Okay, because we discussed the importance of food in relation to the shoulder. You already know that. Okay, so you gotta have a 100% mentality saying I'm gonna get better. Okay, if your output is 100%. You always get 100%. Not always, but most of the time you get 100% reward. In this case, in our clinic, you get 100% reward. Okay. Now we offer a very unique program. I mean, everything that I discussed in the previous slides and movies, all the machines, it's all in the program. It's the entire program. Okay, and this program do not need medication, no surgeries, no shots, and you get healthier, you lose weight, you get tons of energy, your circulation is going to get better, there will be no constipation, your sleep is going to get better, your brain is going to get clear, you have no brain fogs, okay, and all your organs are going to be healthy, you're going to feel like a totally different person. You will, and I promise you will, if you do exactly what I tell you to do. And when you do the changes, your diet, your habits, okay, you are going to get so happy. You're never ever going to regret coming here for treatment. Okay, and again, I do not accept every single patient. I do not, like I mentioned, if you listen, if you accept what I do, what I say, you do exactly what I say, then you are the right candidate. Okay. Then again, I do not accept patients that smoke. If you smoke, if you drink, you're never ever gonna get better. There's way too much toxicity in alcohol and in cigarette. Okay, I cannot accept that. Patients do not get better. Okay, if you take more than 1 or 2 or 3 medication, you probably will not get better too because the toxicity level in the medication is affecting, the side effect of medication is affecting your body to get healthy. Okay, if you want to work with me, you gotta go to a medical doctor. Or go to any medical doctor that's willing to work with me in relation to these medications. Or maybe change a better medication for you. Maybe a medication that will not affect your shoulder, will not affect your muscle. And there are medications of which you can substitute. Okay, discuss it with your medical doctor or come to me and let me know. Okay, people that does not willing to control the diet, that will not willing to take supplement. I don't take that. I do not take that. Okay. People that doesn't have desire to get better, I don't take it. Okay. Like I said, I only take patient who's willing. I only take patient who's a severely chronic disease, shoulder pain. I only take those kind of patient. Okay. So, so in the DVD, there is a form which you can fill up. It's an intake form. So fill that up before you come. All right, and then we offer a consultation. Now, what does consultation involve? So you come to me, all right? You come here, and when you come here, I will go over your history. I will do some pulse testing. I'll do some neurological testing for you. Okay, you can request. If sometimes I forget, but you can request. Ask me to do that for you as well too. All right. And if I see that you need MRI, if I see that you need X-ray or blood test, then I'll write a prescription for you to get MRI done, to get the X-ray done, to get the blood test done, and you go home. Okay? Of course, before you come, you gotta make sure you gotta watch the video. If you don't watch video, don't come back. All right. So when you come back for the second free consultation, I'll go over your X-ray, your MRI, your blood test, go over your pulse results, go over your neurological testing results, and then go over your goal. You know, whatever you want to accomplish. You know, if you want to be able to ride a bike, if you want to be able to lift weights, to play tennis, if you want to be able to golf, you know, to play with the children, set your goal. Set your goal. Okay? And if everything goes well, then my assistant is going to come in to discuss the financial plan. The financial plan. Okay? The financial plan, we only discuss that after we review everything. We never ever discuss financial plan before because we don't know what's going to happen. We don't know if you are treatable. We don't know if we can accept you. We don't know if you are a qualified candidate. We don't know if we can help you with the condition or not. Okay, some condition cannot be helped. Okay, so we usually don't discuss that beforehand. Okay. Now there is a decade rule. What that means is that if you are 30-year-old, it usually takes about 30 visits before you start feeling some improvement. If you're 50, it usually takes about 5 visits before you can start feeling some improvement. All right, so don't get so anxious saying that, oh, I don't feel the first session, I don't feel anything at all. Don't get anxious. Think about you have chronic pain on the shoulder for how many years? What, 5 years, 10 years, 2 years? And you expect me to fix you in 1 or 2 visits? Be realistic. Be real. It's not possible. It's just not possible. Okay. So most of the time, I will tell patients if you have chronic pain for what 5 years, expect to be, expect the treatment to be around 3 to 6 months. Most of the time, it's going to be 3 to 6 months of treatment. And after 3 to 6 months of treatment, you're going to get better. Your shoulder's going to be, the pain is going to be gone. You can do anything you want. You can go back to sports. Then the maintenance comes. Maintenance comes. I will teach you exactly how you can maintain so the pain does not come back. Okay, it's very easy, very easy. But it's the controlling part. It's your habit. It's your food. It's your eating habit. It's your taking supplements. It's your regular exercises. That is the hard part. Because you gotta maintain it. Your mental has to be strong in order to maintain everything else. Okay? So again, come with your spouse. For the consultation, for the 2 consultation, please come with your spouse. They have to support you. If you don't have the spouse support, it's very difficult to get better. Very difficult. Okay? Now a lot of patients will ask me, now does my insurance cover? Now I have this insurance, I have that insurance. Well, first off, Obamacare do not cover. Obamacare is bad insurance. It's very bad. Okay? If you go to medical doctor, a hospital, they'll help you with that, but not with private clinic like us. They don't cover, they don't pay us. Okay? Medicare, same thing, they don't pay us. HMO, they don't pay. I'm sorry. Okay, most of the time you gotta go with cash. Okay, we do take some PPOs, but in order to know if we do that or not, then call my office, ask for my assistant, and she will tell you how much of your PPO will cover. Most of the time it's gonna be a partial coverage. It will not cover the entire treatment plan. Okay? So last advice. The very last advice before we close this is do not sleep on the side. Don't carry anything heavy. Don't stretch if you have pain. A lot of patients think, oh, I'm going to stretch it out. No, it would not work. Don't use it. Don't overuse. If you have pain in the shoulder and you working and you think, oh, you might be thinking, oh, I'm going to work it out. I'm going to just work. It's going to go away by itself. No. If you have shoulder pain more than a few months, it will not go away by itself. Don't overuse it. The more you use, the more damage you're going to have with the shoulder. The more damage. You understand? The more damage you have with the shoulder. Okay, don't over carry heavy things. Don't do a real heavy massage. You know, if you go to the massage therapist, they're gonna rub this and rub that direction. They got cracky bones. No, bad, very bad idea, very bad. A lot of time it will worsen the tear if you have a tear in the shoulder. Okay, it's gonna worsen the muscles, the tendons or ligaments. Okay, it's gonna further damage your bone, which further compress the nerve. Okay, don't do that. Okay. No sports, don't work out. No Chinese food, no MSG, most important. No Chinese food, no MSG. Okay, if you cook at home yourself with great ingredients, yes, please do that. Please do that. Okay, again, no sugar, no wheat. Don't eat anything bad. Stay off nightshade vegetable. Okay, that's the best advice that I will give you, which is more than enough. More than enough to help you start off. Okay, if you follow exactly what I do, just those simple advice, you're gonna get some improvement by yourself, on your own. Okay, so again, are you ready? If you are, give us a call, and our phone number is right here, 626-281-0510. 626-281-0510, and that's our address and that's our email. You're welcome to email me for any consultation as well too, for any question as well too. This is Dr. Lin signing off. Thank you very much.